I'm now going to talk about the tibialis posterior, which is this muscle here. The tibialis posterior comes from the Latin tibia, meaning pipe or flute, relating to the shin, and posterior, meaning behind. It is the deepest muscle of the deep posterior compartment of the lower leg. The deep posterior compartment muscles also include the flexor hallucis longus, FHL, the flexor digitorum longus, FDL, and popliteus muscles. Its origins are the lateral part of the posterior surface of the tibia, the upper 2/3 of the posterior surface of the fibula, and most of the interosseous membrane. Insertion is at the tuberosity of the navicular, and the plantar slip attaches to the medial cuneiform. The primary function of this muscle is to provide stability to the lower leg. It also facilitates foot inversion, swiveling inward, and aids the ankle's plantar flexion, flexing the foot or toes downward. Additionally, the muscle performs a key role in providing support to the foot's medial arch. Any dysfunction of the tibialis posterior muscle may result in a condition known as flat foot syndrome in children and adults. Pain can be caused by arthritic toes, poor footwear such as heels, or orthotics. Sports such as walking, jogging, running or sprinting, hypermobile ankles, flat feet, and prolonged driving can also cause pain in the tibialis posterior. A person with trigger points in the tibialis posterior is likely to complain of pain while walking or running. Pain is generally felt in the sole of the foot and Achilles tendon, and sometimes, though to a lesser degree, in the mid-calf and heel. Usually it is more bothersome while walking or running on uneven surfaces, gravel or cobblestones that are sufficiently irregular and require additional stabilization of the foot. Stretching is excellent for disabling trigger points in calf muscles. Swimming is a good exercise too, whereas self-pressure or pressure tools are not recommended. Runners and joggers should exercise on flat surfaces. Footwear should have adequate arch support, and Morton foot structure should be corrected if relevant.